The do's and don'ts of running a skill station. At the core of every NAEMT continuing education course is the skill station. As you have learned, there are 4 main types of skill stations. In this video, we are going to discuss the do's and don'ts for each type of skill station. One rule applies for any type of skill station. Do not stray from the schedule. Remaining on schedule is the key to ensuring full student participation. The single skill station. A single skill station focuses on teaching a new skill or changes in technique. The instructor works one-on-one with each student until the student gains competency in the skill. Let's explore the do's and don'ts of running a single skill station. Do demonstrate how the skill should be performed correctly. Students recall what they see, so using a video is useful so students will see the correct demonstration the first time. Do use the whole, part, whole demonstration. The instructor should perform the entire skill, then break the skill down step by step and review how each step is performed. Once the student understands how each step is performed, the instructor should demonstrate how the entire skill is performed again. Do allow all students the opportunity to practice the skill until proficient. In order to gain competency in the skill, students must have sufficient opportunity to practice the skill. Do allow the students to practice the skill in different positions or contexts once they are proficient. This allows students to understand how skills may need to be adapted in the field. It also gives them the opportunity to ask questions and problem solve while in the classroom. This may include simply turning the mannequin on its side, placing the mannequin in a difficult-to-reach location, or dimming the lights. The goal is to help prepare the student to perform the skill in a variety of situations. Do correct errors immediately as they occur. Just as it is critical that the students see the skill performed correctly the first time, it is also critical that the student perform the skill correctly the first time. Immediately correcting errors will help to ensure that the student's muscle memory will remember how to perform the skill correctly. Do provide immediate and constructive feedback. After correcting an error, provide praise when the student performs the step correctly. This will encourage the student and reinforce that the student is in a positive learning environment where he or she can succeed. Do reinforce the principles of why a skill is performed. Since NAEMT continuing education courses reinforce the foundational knowledge and promote the critical decision skills EMS providers need in the field, reinforcement of the principles behind the skills is critical. In this example, the instructor is reinforcing the principle of maintaining the pediatric patient's airway by asking why an oral airway should be placed in the unconscious and apneic pediatric patient. The instructor is hoping that a student will answer, to keep the patient's airway open. Finally, we end with a don't. Do not try to integrate a skill into a scenario before a student is proficient at performing the skill. Asking a student who has not mastered a skill to attempt to perform it within the stimulating environment of a patient simulation will only frustrate the student. Allow the student sufficient time to master the skill before moving on to a more advanced interactivity. The key points of running a successful skill station. There are specific do's and don'ts for each type of skill station. Let's explore the single skill station. Do demonstrate how the skill should be performed correctly. Do use the whole, part, whole demonstration. Do allow all students sufficient practice time. Do allow the students to practice the skill in different positions or contexts once they are proficient. Do correct errors immediately as they occur. Do reinforce the principles of why a skill is performed. Don't try to integrate a skill into a scenario before the student is proficient. The integrated skill station. An integrated skill station allows the student to practice a new skill in a safe environment that replicates the field. Let's explore the do's and don'ts of running an integrated skill station. Do prepare the simulation patient. Prior to the skill station, the instructor should prepare the simulation patient. While applying moulage or makeup to simulate any required injuries or illness, the instructor should describe the signs and symptoms the simulation patient will have and the eventual outcome of the integrated skill station. For example, if the simulation patient is in shock and unconscious, then the simulation patient should be lying on the ground with eyes that remain closed. Do not allow the simulation patient to improvise. Each integrated skill station handout will have detailed instructions on how the simulation patient should appear and behave. These instructions should be followed for each and every course and for each and every group of students. Do ensure that each student has a turn performing the skill. If time allows, do repeat the integrated skill station with the students assuming different roles. The goal is to give your students the opportunity to practice their skills as much as possible in a safe environment. Also, do ensure that each student is able to act as the team leader. Each student needs to understand the role of the team leader and how to work together as a team. Do not allow one student to dominate. Give everyone an opportunity. Do reinforce the principles of why a skill is performed during the integrated skill station. Do provide immediate and constructive feedback as the student is first learning to incorporate the skill into the entire patient assessment and management process. Do not turn the integrated skill station into a repeat of the lecture. Focus on the timing and integration of the skill into the patient care simulation. For example, reinforce the principle of applying the tourniquet while direct pressure is occurring and remind the students that the tourniquet is applied before the patient goes into shock. Do correct errors immediately as they occur during initial integration of the skill. For example, if the tourniquet is too loose and the bleeding continues, remind the student to tighten the tourniquet. Do encourage the student to self-critique on the integrating and timing as the student progresses in experience. For example, you could ask, when you applied the tourniquet and the bleeding continued, what were you thinking? Such a question will allow you to determine if you need to correct any faulty reasoning or knowledge. Do not force your preference on the student's technique if the principle is being met. There is often more than one way to correctly perform a skill, especially in the context of a patient simulation. For example, how the student holds a bag when ventilating, probably not an issue, but delivering adequate volumes to achieve chest rise is. The key points of running an effective integrated skill station. Do prepare the simulation patient. Don't allow the simulation patient to improvise. Do ensure that each student has a turn performing the skill. Do repeat the station with students assuming different roles. Do allow each student to be the team leader. Do reinforce the principles of why a skill is performed. Do correct errors immediately as they occur. Do provide immediate and constructive feedback. Do encourage the student to self-critique on the integrating and timing as the student progresses in experience. Don't force your preference on the student's technique. Patient simulation. Patient simulations are used to replicate real-world patient care scenarios. Students are placed into scenarios that require them to react and perform as they would in an actual patient care scenario. The focus is on both the student's assessment and management skills. Let's explore the do's and don'ts of running a patient simulation. Do use props, moulage, and background noise to make the patient simulation as realistic as possible. Do use actual equipment to provide a realistic experience. If possible, add pieces of equipment that are not required for the patient simulation. Sometimes the equipment selection can indicate the treatment options for the simulation patient. By increasing the number of equipment choices, the students will have to determine what to use and what to leave in the bag or on the gurney. Do encourage students to perform all necessary assessment and management skills. If a student asks for the patient's pulse rate, the student should be directed to take the simulation patient's pulse before receiving the answer. Do allow time for debriefing. Debriefing may occur during or after the patient simulation, depending on the group and the goals of the patient simulation. The debriefing should focus on when and why decisions were made or were not made, in addition to the timing, sequencing, and prioritization of the patient's care. Debriefing is a valuable teaching tool that allows students to learn through experience in a safe environment. This step in the patient simulation should never be skipped. Do reinforce the principles of why a skill is performed. This can be accomplished during the debriefing by asking the students to explain the decision-making process that led to the patient diagnosis. Do allow the patient simulation to progress even when errors in treatment or diagnosis occur. Do not correct errors as they occur. Allow the patient simulation to progress and do not correct errors unless a safety issue is present. This allows students to learn from mistakes in a safe environment. The key points in running a patient simulation. Do use props, moulage, and background noise. Do use actual equipment. Do encourage students to perform all necessary assessment and management skills. Do allow time for debriefing. Do reinforce the principles of why a skill is performed. Do allow the station to progress even if there is an error. Do not correct errors as they occur. Critical thinking stations. A critical thinking station allows the students to demonstrate the critical skill of analysis. The ability to take the patient's information, analyze it, and determine a diagnosis is as critical as the physical ability to intubate a patient. Let's explore the do's and don'ts of running a critical thinking station. Do explain the overall objective of the critical thinking station to determine the student's competency in the skill of analysis. The critical thinking station gives the students the opportunity to concentrate on the cognitive aspects of patient care without the distraction of having to perform psychomotor tasks simultaneously. Do allow the student time to fully answer the question. If a student pauses, do not assume that the answer is complete. Allow the student time to collect his or her thoughts. It can be challenging to verbalize the internal thought process behind a decision, so give the student the time to express that process. Finally, do ensure that everyone in the group participates. The critical thinking station is a discussion station and requires the participation of each member of the group. The key points in running a critical thinking station. Do explain the overall objective. Do allow the student time to answer the question. Do ensure that everyone participates.